Today, join us on the 50 Shades of Pain show, where we're going to talk about Dr. Escaloni as a patient. Hi, welcome to the 50 Shades of Pain show. I'm Dr. Danesh, the medical director of Wellward Regenerative Medicine. And this show is all about how to empower you as a patient to take care of your spine and joint problems and demystify pain. I'm here with my co-host, Dr. James Escaloni, who today is also our patient.
Yeah, this is my show today. This is great. We get to talk about my knee, and hopefully you guys at home have been following along to see how my progress has been with this wonky knee that I've had problems with for a while.
So if you rewind and watch the last couple of weeks, we've been tracking Dr. Escaloni's knee. He's been complaining to me about this for months, and I've been saying, James, man up. This is, man up or woman up. Just be stronger. Gender bias.
Mm-hmm.
Gender neutral.
Cow person up?
Cow person?
Yeah, it's like cowboy up, so it's cow person.
I like that. Yeah, cowboy up. There we go.
But cow person because it's gender neutral.
Cow person up.
Yeah,
we really belabored this one. Anyways, you need to take care of this. And so a couple weeks ago, we did an ultrasound on your knee to diagnose, figure out what's going on. And we identified some defects in the saran wrap that wraps around the knee and holds things in place. And so last week we did an injection, what's called a Prolotherapy injection. Now, this is different than the standard injections that everybody's doing, because most often people are putting steroids in to suppress the inflammation, and a Prolotherapy injection is actually doing the opposite. So inflammation we think of as the enemy, but it's actually the process by which our body heals. So we can shape that inflammation and be more targeted about where we want inflammatory processes to take place, so that we can fortify the structures that seem to be weak.
Mm-hmm.
So just give us a little bit of background as far as what your knee's been feeling like before the injection, how we did with the injection, and how it feels now.
Okay.
Cow person.
Well, I had to cow person up for this because I've never had any sort of injection before, and I was honestly really nervous and sweaty and stuff. And so when you watch that video, you're going to see me like, well, I can handle this, I can handle this.
I had to hide his face.
He's like, he just didn't want to see tears. But it really wasn't as bad as I thought it was. So again, thank you for that. I'd had a lot of pain where I was squatting down, and every time I tried to come back up, I had to like shift my weight over onto this side. There was a deep click. If I tried to use a leg extension machine, pushing my knee up against something, there was just never any strength here because it hurt, and this would just shut down my entire leg from doing work. And I've exercised consistently for years, and sometimes like 5-6 days a week, just to try to make sure I'd maintain at least some level of function. But there was just only so far that I could do, and it was limiting me from doing some stuff. And so after the injection, a lot of this deeper pain that was there seems to be gone. This pain that was like really tight on the side of the knee, still a little bit there, but it doesn't seem like I can like pull my leg down and it feels like it's going to tear off. And most especially, I can kick my knee against something and it's not stopping with pain. I mean, I barely hear anything anymore. It used to sound like that.
Yeah.
So some magic juice you put in there.
So to give you a little bit of background about what was going on, there was just a small defect in a couple of places. So our bodies are held together with in a combination of compressive forces and tensile forces, meaning things that squish and things that pull. And if there's an imbalance in that, then your body has to compensate in order to maintain function. But that compensation is kind of like the wheels on a car being misaligned. You can drive with a car that's misaligned, but your steering wheel always pulls to one direction. So over time, you compensate by steering a little bit in the opposite direction, but over time, that's just eroding the tires. And so all we're doing is we're realigning things by correcting some of the tension discrepancies in the knee. And in your knee, there were two areas that were essentially opening up. Like we could see it on the ultrasound that this area is defective. And so every time you moved your knee, it was causing that area to slide open, and other muscles would have to compensate to pull it back in. So all I did last week was we injected some prolotherapy in those two locations, which creates like a stickiness there, and an inflammatory process where your body's then going to recruit cells to that area and tighten things down and batten it down. Now, you've done amazingly well because we're only a week out, and usually these are injections that we need to do like 2 or 3 times before we get to see some meaningful outcome. And even then, it takes several weeks. So, tell us a little bit about your normal lifestyle, because I attribute the rapid response not just to the injection, but also to the fantastic rehab, nutrition, and lifestyle that you live.
Well, I eat healthy. I take in collagen at least once a day before I exercise, and we've already had a show talking about how collagen can help ligaments. I do blood flow restriction exercise because that's helpful for my knee. And actually this week I also did the MLS laser at least once on my knee to help that recovery out as well.
And to give you a background, MLS laser is certain wavelengths of light that are shown to activate the deoxygenation of red blood cells, meaning that it has a stimulating effect on red blood cells, which increases the circulation and increases the oxygen flow to that area.
Yeah, I'm feeling pretty good because of all that stuff right there.
Yeah, and I would say that the active, healthy lifestyle ahead of time was a big, big factor because your stem cells are constantly on the move and mobilizing. Every time you exercise, what you're doing is you're breaking muscles down and incentivizing cells to come in and refresh or regrow new, healthier muscle fibers. So the fact that you exercise on a regular basis is a big player in the speed of your recovery.
Sounds like exercise and physical rehabilitation has a role in this, huh?
Absolutely.
My bias.
Little bias there. But yeah, absolutely. And that's one of the, I think, the deficits in all of medicine is there isn't this cohesion of intervention and rehabilitation that really work together hand in hand.
So we already figured out that injection was helpful for me. So now what's the next step? I mean, I'm just putting myself, taking my brain out, being dumb for a second. Doctor, what do I do now?
You have to go to a New York accent if you're taking your brain out.
I don't know.
So from this point, we're going to just follow it and see how you do, given the rapid pace of recovery that you've already shown. This may be something we just keep an eye on, but I would suspect that in a few weeks, you're going to start to plateau. And depending on where you plateau, if your plateau is, I don't even notice it, then we're done. We don't need to keep doing anything. I would just do the healthy lifestyle things to keep up maintenance. But if you start to plateau and there's still room for improvement, that's a time where we may want to repeat the injection or take another ultrasound and look to see what other problems may have risen, because your body's going to localize the weakest link. So if you've got 6 structures that are moving your knee and 2 of them are problematic, it doesn't necessarily mean the other 4 are not problematic. It just means that these are the 2 weakest links and going to be more loud in their pain signaling. So as those improve, we want to see if they reach their maximum point of improvement, and if there are other issues that were waiting in the wings, and now that this is stronger, they are now becoming the weaker link and need some touch up there.
Of course. That sounds like a plan. I don't mind exercising continually and taking more of that collagen and living healthy. Sounds like a good plan to me.
Excellent. Well, we're happy to have you at our 50 Shades of Pain show. We're doing this on a weekly basis. It goes out on all of our social media platforms, LinkedIn, Instagram, Facebook, and as always, you can find us on our Wellward web page, wellwardmed.com. this is a show that we want to help encourage people to take better care of themselves and empower them to be in control of their bodies, particularly the spine and the joints that create a lot of problems. So if you have any questions, feel free to write us on any one of our social media channels. And until next time, I'm Dr. Danesh.
I'm Dr. Escaloni.
Thank you.